Okay, so let's start with pregnancy. Are they effective?
Yes.
How effective?
So really effective. There's two kinds. There's ones that are copper, very effective, but a little bit less than the medicated ones, which have progesterone in them.
What are the numbers here? Are we talking about like 80%, 90%,
90%.
90%? More than 90%.
Yeah,
Okay.
Approaching 99. Like I can think of 3 pregnancies in my 20 years, 26
Really?
years
With an
IUD, yeah.
Okay, that's
So I think that's a useful piece of information. So not 100%.
Nothing.
So you may want to consider a second option as well.
Yep.
But very, very highly effective. Okay, so the second reason that someone would consider having an IUD.
A big one is emergency contraception.
Okay.
So if you find yourself having a unplanned, undesired pregnancy and your contraception failed or you didn't use it, we can use IUDs for up to 5 days. The copper ones only, not the medicated ones.
Okay.
There's a 5-day limit on that one. Beyond 5 days.
Sometimes up to 7. Will even depends on who you. The further out you get, the less effective. But it can be useful when things like Plan B no longer work.
Okay.
So the IUD, now known as IUS, as everyone commonly thought it was to reduce the risk of pregnancy, but now also we're talking about reducing heavy menses.
Yeah.
And even possibly risk of cancer in these settings?
Exactly, yeah. So we use it to reverse something called hyperplasia, which we traditionally used to give people oral progesterone, so now we can just deliver it.
Okay.
Nice.
And then we're also using it for hormone therapy. So a lot of women who have terrible hot flashes that can't manage without estrogen, rather than taking estrogen and progestin by mouth, so we're reducing our hormone. We always want to reduce exposure to hormones and achieve the highest benefit.
Right.
So one way of doing that is we can put the IUS in the uterus and just give them the estrogen by mouth, and then we're cutting out, exposure of hormones. And people are hormone averse for good reason. There's lots of media attention, but hormones are great when we need them because they help manage our symptoms.
Okay. Now we talked about the device itself. How does someone go about getting one of these?
So they're mostly covered by third-party insurance if they're medicated. If they're non-medicated, they don't have that drug identification number, so you have to pay for them.
So you mean the copper ones you have to pay for?
Correct. And they run about $100, and there's different kinds. There's some for people who've never had a baby or the null one. There's some that are 5 years. Then there are some that are 10 years.
Okay.
So 10 years are a really good return on your investment because it's $100 for 10 years. That's pretty reasonable.
Yeah.
And then
Where is this done? Where is this inserted? What's involved in the process itself?
So it's mostly done in doctors' offices by healthcare providers. So either family doctors, some midwives are training. It doesn't have to be an obstetrician, sexual health clinics, lots of places. And if you do a lot of them, it's pretty simple.
How long does it take?
It takes about, well, it depends on the person doing it. The provider takes about 3 minutes.
Okay.